Good afternoon, everybody. I want to welcome you to the Broadcast Technology Department of After School Matters that was initially at Gately. Since we've moved on to remote learning, it's been a little difficult, but I believe in the students that I have, and I think they did a great job with their interviews. I believe they did a great job with everything that they've done. My name is Mr. Sapp. I was the instructor, and I'm going to let them introduce themselves so you guys can know who they are and the work that they put in. So you guys can go ahead, and we'll start with Tina, Julian, Antoinette, Fernanda, and Isabella.
So my name is Tina Thomas, and I was a writer for the questions that we asked in the interview.
Julian.
My name is Julian Garcia. I was brainstorming a couple of questions that we use for the interviews.
Antoinette.
My name is Antoinette Brown, and I was the person to do research and have follow-up questions.
Fernanda.
My name is Fernanda Torres, and I interviewed some people.
My name is Isabella Castro, and I was the one trying to brainstorm and do everything else as well.
Okay. So we want you guys to talk about the production that you did. We initially came up with the idea of doing a small documentary on the coronavirus. And what I'm looking for from you guys, and anybody could jump in at this time, tell me the process from the start to where we are now. Tell me the process of the entire production.
Well, I could say the process from the beginning to now, it was kind of simple and easy, even though I already took broadcast technology before. But with me doing it overwise, I feel like it was good, it was okay, and it was actually fun, learning more stuff that's going on and where we live in our community now.
To add on, I felt like in the beginning we didn't really connect, and then more and more we talked more and communicated more, and we had to share our ideas, so that was something we learned as a whole group.
Okay. Tina, Fernanda, and Julian.
Well, to me, this is broadcast technology is pretty new to me, but I was able to learn quite a bit or quite a lot actually within a short amount of time since since we did it virtually.
Okay.
I felt like I learned a little bit more than I learned when I was in class because I had broadcast tech during school. So I learned a little bit more than I intentionally thought I would learn.
Okay.
What was the question?
Uh, what was the process like from the beginning to now?
Well, at first, coming into this, I didn't know what broadcast technology was at all. And then throughout, at first, it was kind of hard learning, but afterwards, when we got kind of used to talking to each other, then that's kind of when I learned more. And yeah.
Okay, so why don't you guys tell the people, what is your favorite phase of broadcast technology? Remember, we talked about the three phases: pre-production, production, and post-production. What was your favorite phase to do, and why was that your favorite phase?
I say mine was pre-production because pre-production is ain't that when you get actually start doing anything with the interview wise and documentary and stuff. So it was time to try to come up with brainstorms and idea and how we gonna exactly do it and come up with anything to put together.
Okay.
I liked pre-production because it was I wouldn't say easier, but I would say coming up with ideas was like the easiest part of it, and then the production was like a little bit difficult. And like if you run into a problem, then yeah.
It's like you had to figure it out on your own. Okay. Anybody else?
I would say the same as what Antoinette and Isabella said, because we're just brainstorming at that point and it's not really like challenging. We just have to make up like an idea of what we're gonna do.
Okay. Julian?
I agree with what they said too.
Okay. Tina?
My favorite phase of it was pre-production because you can come up with different ideas and stuff, and like pretty much both pre-production, post-production, because you can see what you thought of and what your friends or classmates or whatever came up with, and see it come to life, pretty much.
Okay. And last question, I want you guys to explain what was the production and post production process like for you guys with doing it remote learning? Because we explained it, we talked about it in class, we had the discussions, and then it was kind of like you guys had to do it on your own from those explanations. So why don't we start with Antoinette? Why don't you tell me what was that process like for you, the production process and post production?
I feel like it was okay, but it was kind of difficult because knowing that like we had to do it on our own in the beginning, but at the same time, it actually became easier because we actually started coming together and started working together and coming up with ideas and stuff and how did we want to like to do the interviews and the documentary and plan it out before we actually like came up and started doing the interviews and stuff and came up with questions and follow questions to make sure everything followed out right.
And what about post production? How would you with the editing?
Post production, it was good. It was okay. It was easy to me.
And what did you edit with?
Like the app I use,
Yes,
I use iMovie.
on your phone.
Yeah.
Fernanda?
I would say the same. It was okay because we were able to get help like as a group, but it was kind of hard since it's virtually and you can't actually ask in person if you need help. And I feel like that's quite challenging. And with the editing process, I think it was okay too because if you had questions, as I said, like you can't really ask for help unless you email, unless we email you. But besides that, I feel like it was okay.
Okay, and what editing software did you use
iMovie.
on your phone?
Yeah.
Okay. Isabella?
I felt that at some points I ran into problems, but at the same time it was okay.
Okay. And what editing software did you use?
I used the one on my computer. It's just video editor.
Okay. And what problems did you run into?
I ran into where I didn't have enough space and it was too long and I had to trim the video and uploading the video. So I ran into those like problems.
Okay. Tina?
Like it was like production was easy, but it was like kind of hard because you got to work with other people's schedule.
Mhm.
So that's what I had to work around and stuff like that. But editing,
You're
it was
talking about
pretty
QE, right?
yeah.
Okay.
So like editing was like okay,
And what software did you use?
video editor on my phone.
Julian?
Uh, for
Your mic's muted.
for editing, I used iMovie. It was my first time using it, so that was kind of the hard part for me because I didn't really know how to use it. And at first, the video was too long, so I had to trim it. Yeah.
Okay. And so for me, I would say that you guys were a great audience. I mean, I'm sorry, you guys were great students to this. You actually like emailed me. I was getting emails like all times of the night, and I tried to do the best that I could with making sure that you guys were those questions were answered, and I hope I did a great job for you guys with that. And looking at your edits and everything, you guys did an amazing job for a lot of you, which is your first time coming into the production industry and coming into broadcast. And with Antoinette and Tina, I know I have them as students at Corliss. They're still beginners. They just finished Tech 1. So with this, I know it was kind of difficult for moving into the classroom because they know how I am hands-on with them. They have a lot more time with one-on-one time with me. So with them doing this by themselves, I was very proud of you guys. You did an excellent job. And from the start to the end, I know the end was the most difficult part with the editing process because what we had to do was take their edits and combine them together. And I joined in with helping them with shooting some interviews since we wanted to protect them and not necessarily going anywhere. We're practicing social distancing, and I wanted to protect the students. So I jumped in and got some edits that you will see in the production. So without further ado, let's get into the actual production, what you guys did.
But it's like since the coronavirus came into the US, it's like it made it even worse because it kind of stopped people from working, people from having income coming in, paying their bills and stuff like that, take care of their family, children, kids.
All businesses are trying to limit how many people are around each other, so they just try to. So a lot of people have lost their jobs as a result of that.
Social distancing has affected my lifestyle by not having a lot of people around me. A lot of people are staying away.
Coronavirus is a deadly respiratory disease. It can be spread from person to person and remains to be without a vaccine. Anyone of all ages, gender, species can catch the disease due to its being airborne and able to stay on surface and enclosed for several hours.
I caught it actually from being at home. My stepfather was the first one sick, but he didn't think he had the virus because everybody's symptoms is different. My mom got sick next, and then I got sick. A lot of people thought that I caught it when I went to Miami, which was like 2 or 3 weeks before, but that wasn't the case because literally I remember putting my mom's mask on and I got sick immediately. My mom being in the same room with my stepdad, she got sick immediately. And this is way after we came back from our trip.
The effects of coronavirus are headaches, muscle pains, fevers, coughs, chills, sore throats, congested runny nose, diarrhea, loss of taste or smell, and etc. Symptoms that may involve emergency care would include trouble breathing, constant pain or pressure in the chest, and the ability to stay awake.
The very first day, which was the day I put on my mom's mask, I went to the store. While I was in the store, I just caught a headache, but I didn't think anything of it. I kind of felt lightheaded. I was like, oh, well, maybe I should just eat something and I'll be all right. My grandmother, she told me to go to the hospital because it was too many days of me being in that state or feeling that way without medicine helping. When I went to the doctor the first time, this had to be maybe like 5 or 6 days in, and they did a flu test, and she asked me did I want a COVID test, but I said no because everything that they were saying I didn't have. Everything that every nurse, doctor, practitioner, anybody came in and asked I didn't have, so I declined the COVID test. They said that it was just pneumonia and I was able to go home. So they gave me some fluids and I felt better. But by the time I got back home later on that night, I literally felt the same exact way I felt when I came in that morning. I tried to wait it out, taking all different type of medicine, making sure I'm hydrated. Maybe 3 days later, I felt real worse. I started to vomit. And I knew something was wrong because I couldn't stop vomiting. I couldn't eat, no taste, no smell, nothing. At this point, I haven't had nothing in a few days as far as eating wise. Once again, I was stuck on the couch for, I want to say maybe 3 or 4 days. My grandmother said again, you need to go back because this doesn't make sense. You can't move or you can't do anything. I went to Rush, and as soon as I got there, immediately they said that I was a COVID patient. They came and got me from my grandmother's car with a wheelchair. I couldn't walk. They didn't let me even go in the hospital. They took me like through a back route, through a garage, upstairs. When she took my temperature, it was 102.3, I believe. I got in the emergency room. They did an x-ray. It went from being my lower body that was filled with fluid to my entire chest. They called it double pneumonia. He wanted to send me home. I told him that I didn't want to go home because I didn't feel like I would be able to fight whatever it was while I was at home. I asked, could I stay? He said they were going to keep me for observation. While I was in the hospital, my temperature rose to 103.5. They couldn't give me any medicine. They weren't giving me fluids. But when I told him my entire house was sick, he stopped because he was positive that it was COVID. Back then, it took 2 days for the COVID test to come. And once again, I didn't get any medicine. The only thing I was able to take was Tylenol. And I had ice packs around the clock. With the nurses, they will only come in every 4 hours unless it was something mandatory. So if I needed water, I couldn't get water. I have asthma. I couldn't take any of the asthma medicine because it made the COVID worse. So I want to say maybe after 3 or 4 days in the hospital, I finally took the oxygen mask off. I'm like, I gotta get out of here and I gotta go home. And sure enough, I went home the next day. My symptoms weren't as bad. The fever was down. I was able to fight everything off. I had to quarantine in my own room when I went home, and I couldn't go out to go to the bathroom. I had to have a commode in the room with me. And I want to say after maybe another week or so this is now, I want to say the 3rd week, it was finally okay and it was done and that was it. But we still had to take precaution because the rest of the house we didn't know. So everybody had to go and get tested.
Yeah, my family is very aware of the COVID-19 and we are very clean, and we wear masks everywhere we go and gloves, and we try to stay safe as we can.
For many businesses, the coronavirus has either slowed business down, adjusted businesses, or closed them down for good. One business in particular that has to have major adjustments is the funeral home industry. Here, we look at the adjustments made and interview staff about the changes during the COVID-19.
Life before the COVID was stress-free. Families could come in. There were no limits until when we were making the arrangements, how many family members could be present. There was no plexiglass. There was no face mask. Now, also there were no restrictions on how many people could attend a funeral service. Now there are only 50 people that are able to attend a funeral. Prior to then, it was only 10 people, in which live streaming, thank God for it, because it has come most certainly in handy during this difficult time. Now when we meet with families, we have plexiglass in the offices that kind of separate us, and only 2 people are allowed to come in during the arrangement conference. Normally, sometimes families have, large families where more than 2 people need to come in. So now we kind of, FaceTime relatives and, kind of phone conference them in so they could hear what's going on during the arrangement conference. We've also been very tech savvy. Now a lot of arrangements are made over the telephone where families don't come in at all. The paperwork's either mailed overnighted or, sent electronically. It's definitely different, and it's not a norm, and it's stressful than what it used to be. We have to ensure that, of course, we don't have multiple families coming in at a given time to make arrangements. We have to ensure that, before you sit down in a chair, the chair is sanitized. Before you pick up a phone, the phone is wiped off. You have to ensure that, of course, you spray before you sit down, you spray after you get up. We've pretty much turned and been doing a lot of custodial work ourselves, just, trying to protect ourselves and our families. We have to ensure that we wear proper PPE pretty much everywhere that we go, if we're not in the offices. And it's a lot of on the phone, it's a lot of emailing, whereas, with typical funeral services and making typical funeral arrangements, you normally wouldn't do that over the phone. You normally wouldn't email a family a casket catalog for them to browse through. More than likely you would be in a casket selection room. You would be able to, console that family, hug that family. It's a lot of distance now.
We are now trying to adjust to that volume that's brought about by the virus, and how we can still give service to the families who are seeking our service, but having to deal with the fact that there are so many other families who are waiting to receive our service also. So we have experienced this acceleration of deaths due to the virus that are causing our people to be risk managers also. We are mandating that our staff wear masks. We are asking families when they come in to wear masks, and we have sanitizers here in all of our offices. At the front door, we are taking the temperature of those who came in. We are only allowing 2 to 3 family members to be a part of the arrangement process so that we can keep our social distancing. And so it has changed dramatically how we do our business. However, we are still challenged by the fact that we have to step up and give service according to the need now that has manifested because of the virus.
The deaths first started in New York and New Jersey, accounting for more than half of the 15,000 deaths reported in the week of April. The death toll of the coronavirus in the U.S. has affected the majority of the nationality, including Hispanics and African Americans.
How has COVID-19 positively or negatively changed your life? Or they could be both.
Positively in the way of, I guess, I got to organize my room and everything. I just settled in, and I was really set in that aspect. And with my family, I got to talk more with my mom and with my sisters. I spent more time with them. And negatively, well, it's a lot of time at home, so a lot of time thinking, and you do get bored. So I guess that's the negative part of it.
They're making everything more... They're just making people more cautious about their own health. So when they go out and when they just interact, it just makes them pay attention more to what they're doing and how clean they're supposed to be.
It has changed our daily lives because we have to wear masks now, every time we go out, and make sure we don't take it off. And that's different from before because obviously we didn't have to wear a mask and we felt more freely in a way. And now we have to also use hand sanitizer or wash our hands more frequently after we touch something at a restaurant, at any public place basically, and make sure we don't touch our face if we haven't washed our hands. And also make sure we're social distancing 6 feet away because we want to make sure that we're not exposing ourselves to other people who are around us.
the number of coronavirus cases have gone up, meaning more patients getting treated at the hospital with around 4.6 hospitalization rate of 100,000. The rates went down in some states because of the stay-at-home order, but as of now, rates are increasing from May till now. The coronavirus seems to have affected nationalities, but it creates some type of discrimination as well. Many Black and Asian Americans have experienced discrimination amid the COVID-19 outbreak. Some people acted as if they were uncomfortable around them, made jokes about them just because of their race or ethnicity. They also felt threatened that someone would physically attack them. A research study says that about 3 in 10 Asians, which is 31%, have been subjected to slurs or jokes, compared to 15% of African Americans. People felt that just because of the pandemic that started in China doesn't mean that a person that is Asian technically doesn't have it or spreading it.
That name gets further and further away from China as opposed to calling it the Chinese virus. By the way, it's a disease, without question, has more names than any disease in history. I can name Kung Flu. I can name 19 different versions.
It's gonna sound crazy, but I really thought like we couldn't get it, because when I was looking at all the stories that was coming out, it wasn't any of, what can I say, African Americans who was catching it. And on top of that, it was like this scientist lady, she was talking about something that's in that I don't know, some type of way you can get the COVID, but African Americans are supposed to have less of it. So I really wasn't taking it serious because it never really hit home until I came home.
Do you feel safe when others around you don't follow the proper safety guidelines?
I actually do not. I feel like they're only thinking about themselves and they're not really thinking about anyone else's health. So it's a little nerve-wracking, to say the least, sometimes.
Everyone doesn't have it, but it's like a majority, I would say no, because at the same time, I don't know who have it or anyone that had it before, and they can actually pass it on to me. So I wouldn't know if someone had it before and they pass it on to me. So I wouldn't know if I had it or not unless I go to the doctor and get checked out. So it's like I really don't feel safe because, I don't want to risk my life and my family members that I live with and try to put their life in danger with them catching the coronavirus.
I do not feel safe whenever other people are not following the safety guidelines because of the fact that they might be putting my life more at risk, not knowing if they're infected with the coronavirus or not, and me being around them just makes me feel not safe at all.
One of the main safety precautions taken for teens and children during this pandemic is the closing of schools and the introduction of remote learning. Remote learning has affected students, teachers, and parents. Students are now required to log into the class via Zoom meetings or Google Classroom for class assignments and class instruction.
Like most kids really learn better in school instead of this computer situation, because I feel like since now I am a student that's not in school, and I feel like most students is really not paying the e-learning that much attention how students was paying attention in school-wise. So I feel like the coronavirus made the U.S. worse than what it was before.
E-learning isn't as bad as, it's not bad in my opinion. If most people say, oh, it's not what I would, it's not good for kids. It is good because it keeps us safe, but at the same time, if you're like a hands-on learner like myself, it's like it gets frustrating from time to time.
E-learning affected me because I'm more of a hands-on person and I prefer classroom settings, and I get one-on-one help in classes with my assignments, so that would be a reliable source that I would need in my classroom. But at home it was something different because I wouldn't get that help from the teacher, and it was just harder to to complete my work and my assignments when I needed help.
My name is Julian, and how I think that coronavirus and doing remote learning affected kids. It was, for some, it was a positive thing. For some, it was a negative thing, because a lot of kids struggle not being able to be with a teacher right next to them. Some just couldn't concentrate. They were distracted. They couldn't keep themselves on track. And since there was no one there to, like, if they didn't do something to tell them why or to push them to make it, they wouldn't be doing assignments. They could possibly fail, and it was hard for them. For some people, it was a positive effect because it's made them more responsible. It also made them, like, take care of themselves if they were home alone with no one else.
Any last final thoughts you like to say because of the COVID?
I really hope they find a cure, because I really do want to see my friends and family again. And I would like to go traveling to a lot of places that still await for me.
Wow, I really I can't see so far into the future right now regarding COVID, and see how and when it's going to actually kind of diminish, or the cases are going to diminish. I really can't see that. I hope they actually do go down, but it doesn't, in my opinion, it doesn't look like it's going to actually decrease anytime soon, unfortunately.
This is something that will not go away. We've got to deal with it, and we are hoping and praying that there's a vaccine by the end of the year that we can attack it from that perspective.
It's not a joke. That's it. It is not a joke. If you can, and if you do feel that following those precautions are helping, I advise you to do so, because like I said, y'all, I remember them calling and asking me how I felt, and I told them I felt like I was fighting for my life. So the only thing I can say about that is take it serious.
So for people who aren't taking it serious, I would say come to a funeral home and volunteer, and you'll see in a matter of 10 seconds of being at the funeral home that COVID-19 is serious.
If they're not caring about their health, then I feel like they should at least take into consideration about caring about other people's health, because we don't know where that person has been before, and if they're right next to us or something, then we could be the next person that could get infected just easily by standing next to a person who could possibly have corona. And I feel like if they're held accountable, then they will set more of a limit to the people who don't really listen to the social distancing guidelines, and we could have more control over it.
I see a lot of smiles on faces now. Okay, so now we have the final edit. You guys have saw it from start to finish. What do you think?
I actually think we did good with like coming together with this video, and even though we didn't know it like too much about like broadcast technology, I feel like we actually did good for our first time.
I liked it, and I don't know. I just like it.
Feel proud.
I feel like we did good as a group, even though we don't even really know each other. So yeah, it's good.
Okay. What about you two?
I honestly think it came out pretty good. Yeah.
Okay.
Uh, it was pretty good. The music that was in the background, I don't know why, but it just like it made it feel like it was like a commercial or something, like something professional.
Okay. So with this is their first time actually looking at the completed video. What we were working on during class was taking all of their edits and putting it together. So they never saw it until today, the completed video. They never saw it until today, and they're watching it with you guys. So I want you guys to commend these young adults, these teens. I don't want to call them kids, but commend these young adults because again, this was their first time doing this. So with them stepping out with their first time and beginners, I think they did an amazing job. I think that they did the best that they could do. And again, like I've always told you, with this field, there's always room for improvement. Nobody walks around and just says it was perfect. There was nothing wrong. There was, and I feel like you guys took everything that I taught you and you ran with it and you did the best that you could. And I'm no less than proud of you guys. So this brings a close to the summer session of broadcast technology. Um, Proud of you guys. Be proud of the work that you did. And do you have any last statements about the class, about the project? Anything that you want to say to your audience as they're watching right now? Now's the time to say it. Everybody's good?
Yep.
Yep.
Yeah.
Yes.
Okay. I hope you guys enjoyed your summer session with broadcast technology, and I hope you guys enjoyed watching. This is the class, the broadcast tech class, and thank you.